A joint older people's commissioning strategy covering both health and social care is one of the key parts of the new health and wellbeing strategy. People are living longer lives, we want them to live those longer lives independently and in the community, and that sets a new set of challenges for both health and social care, and this strategy is a way of bringing everything together and enabling us to meet those challenges.
This is a groundbreaking initiative about health and social care coming together to be able to plan for the future. And the aims of the strategy are to enable people to live independent lives in the community, to provide more for people in the community, and to make sure that all the services working for older people work together.
I have had one or two problems, and I think the main problem is coordination between the major hospitals and the community. As my husband twice was discharged on a Saturday, and the link was not made with the referral was not made to the district nurses, as it would have been so helpful, because they told me to ring up on a Monday morning. The district nurses hadn't heard of me and were rather surprised to get a phone call instead of a referral from the hospital or the doctor. And they were very busy, and they said that they didn't normally visit people at home if they could get out. So I had to wait for 3 or 4 nights before a district nurse came, and that meant that because my husband had to have a catheter, it was necessary to get up 2 or 3 times in the night to make certain that it was working satisfactorily.
I went for my pre-admission visit and I got a leaflet from the person there, and that's all that happened then, that said my assessment to go home would start. Immediately I went into the hospital, but that didn't happen. But I did speak to 1 or 2 people on the ward, and they were not aware of anybody coming round and planning their exit from the hospital. I didn't see a social worker. Nobody identified themselves as, we're coming to talk about your care plan with your family, as it says in the leaflet. That didn't happen at all. And none of it was done by the social work department. It was all done by the nursing staff.
People say to me, when did you lose your mum? I don't know when I lost my mum. I lost my mum over 5 years, an inch at a time. And it was unbelievably painful. And it's affected me since she died. So much more profoundly than I thought it would. It damages, and it doesn't just damage the sufferer. We need better understanding, better support, and far more consistency. I felt towards the end of my mother's life that I was having to fight for her rights every minute of every day with people who should have known that, who should have already understood, who should have respected it, but really didn't.
It's important that people stay within their own homes as long as possible, because it gives them, it makes you happy. You have the things you love around you, and you don't feel pushed as if society wants to get rid of you. And that is very important to us. We gain old.
GPs traditionally have been our source of information for a lot of things, and usually they're easy. Although GP surgery setting has changed over the years, whereas before you had an identifiable GP that you saw each time who grew old with you, but now you have a group of GPs in the surgery, and you'll be seeing any of them at any given time. So there is that effect on continuity, if you like, and your bonding and identification with a particular person. But the system still works pretty well. People get to know 2 or 3 GPs fairly reasonably well, and it seems to be holding.
So for older people, we know that the population over the next 25 years is going to grow very significantly, and there's much less money to pay for care. What people are telling us is they want advice early on how to use their own money so as to stay out of care for as long as possible. They need to be able to get to activities that can help them stay well. When they get ill, they want the right care at the right time, at best at home. When they need hospital or to go into long-term care, we need to make sure they get the best quality care. For carers, society's major asset, we need to make sure they're supported in their caring role. And our societies need to be much more dementia-friendly, so that people can come forward at an early stage and seek a diagnosis and remain home or in their own environments for as long as possible. What we also know is that we need to make sure we use the money that we do have wisely and well.
So, to sum it up, I think a great deal has been done to improve services for carers and for people, older people at home, but it's very important that health and social and community care and the public health work together to improve services, as it's absolutely vital to prevent people going to hospital and to keep them at home as long as is possible.